Hey, what's up, everyone? It's Dr. Glenn Vo shooting another podcast at the CDA. I'm really excited. I'm really excited to bring one of my good friends on, someone who's not only a good friend, but also, he's a mentor to me, but also one of the most generous guys in the industry is John with Archy. John, welcome to the podcast. This has been a long time coming.
I know. I've been looking forward to it. Thank you for having me.
Now, I have to establish something. This is something that I pretty much think that everyone who ever meets you wonders about, and that is that your true accent?
It is. I'm French. The accent, I cannot fake it. I cannot remove it. So it is my true accent.
Now, where in France are you from? Where's home for you? Where's your folks live?
So it's a small town in the middle of France called Bourges. Probably nobody has heard of it. It's like 2 hours south of Paris.
Okay. And follow-up question is, are you going to the Olympics?
I am not, actually. It's funny, like I discussed with my parents and they're like, do not come during the Olympics. It's going to be a mess. It's going to be crazy. So I'm going to be watching online, but I will not be going to the Olympics.
Yes. Okay, so we had the established thing, but another thing I want to establish right now, obviously you guys heard a lot about Archy. I'll let him explain the story behind Archy, but a big story is who dragged you, or why did you, who pulled you into dentistry to work with us crazy dentists?
That's a very good question that I get quite a lot. And that person is my wife, who is a dentist. And funny story, even when I met her, she told me she was a dentist. She graduated, she was 21. And I was like, there is no way you're a dentist. And then for many years, she was an associate. And then suddenly she decided to open her own practice.
Yeah.
And through that experience of opening a practice from scratch, I got involved.
Yeah.
That's how she got me into it. If you'd asked me 5 years ago if I would be doing Archy, if I would be in dentistry at a dental conference, I would have told you definitely not.
So if I heard that correctly, John, are you saying that Archy is actually your wife's idea?
It is. It's experience through her own dental practice. The fact, it started with an IT company that ripped us off, didn't do the backup of our server that they were supposed to do. The fact that she had trouble finding the right staff. She had to juggle with different software to run the business, it, right? And so through that experience, we're talking, we're like, what can we do? And I come from the tech world.
Yeah.
And I was like, maybe we should actually build a better software for dental practices. And that's how it got started.
Well, we're going to go into your background in the tech world. And that's why I've always been really excited about Archy. Look, there's a lot of platforms out there. A lot of those platforms created by dentists, and that's great. But they don't have the influence, the skill set of someone from Silicon Valley. So we're going to talk about your background there. But before you do that, when your wife was opening her practice and she was looking at all the options out there, and when you were looking with her, let's be honest here, what was your first, I guess, again, someone from the tech industry, the tech world. Let's be honest here. What was your first impression when you saw what we had to deal with?
I was like, it feels like we're in the year 2000. It's antiquated, overdue for a new technology. The fact that we had servers.
Are you saying that it's the equivalent of someone still using dial-up? Is that what you're saying?
That's that equivalent. Yes. It's funny. We talk about cloud, and even sometimes, even in 2024, some people are like, what is the cloud? Or I don't know if the cloud is the future. And I'm like, the cloud is not the future. The cloud has been here for 20 years.
Google Drive, Dropbox.
Salesforce was founded in 1999. 25 years ago now.
And here we are still using server base.
That's right.
So, obviously you saw that, but let's kind of jump into, before we talk about Archy, because there's so many things that I love about Archy. Not only the fact that, it's so easy to use, but let's talk about your background. So again, you talk about, you have this tech background. Talk about some of the companies that you've worked with.
Sure. I've worked for two very tiny companies that most people probably have heard of at some point. One is called Uber. The other one is called Facebook. And so I spent pretty much 10 years, even before that, at SurveyMonkey, which is a bit smaller, but most people still have heard of them.
Oh, yeah.
Building payment platforms. So if you pay for a Uber ride today, if you order food through Uber Eats, if you tip your driver, those are functionality that I built during my time at Uber, and that my co-founder and some of our team members at Archy actually were part of as well.
Wow.
If you use Facebook, it's mostly for the advertisers. But if you're a business, like a dental practice, advertising on Facebook and paying for those ads, well, the payments actually is the platform I also worked on.
So I'm going to bring something up, and again, this is going to be something just really John's going to find very amusing here. But looking at all the practice management softwares out there, and just comparing like the amount of effort and maybe skill and time put in creating those practice management softwares, right? And comparing it to something like an Uber and a Facebook, how would you compare that? Let's compare. Like, is that like comparing like a Tesla to like a tricycle or something? Like, give me the comparison.
That's actually one of the comparisons I make quite often. I often say Archie is the Tesla of the dental industry. You had GM and Ford who built cars for many years, and then Tesla came in, built a new type of car, electric car with a big screen, like really didn't necessarily just copy what was out there. And that's the same for us. There are companies that were there 20 years ago, 30 years ago, 40 years ago. They could have gone cloud. Some did, but even like try to reinvent what's existing. And for us, we took a very different approach. We're not copying what everybody else is doing. Sometimes we are really reinventing what is being done. And so, I mean, if I compare, even from my background, the tech world to dentistry, sometimes there's a big gap.
Sure.
It's a big surprise. It was a surprise for me when I had to really look into the space. And even meeting with dentists. Sometimes what was pretty much standard for me, and Silicon Valley sometimes can be in its own bubble, like we are in our own world, was not standard for everybody else. What's
so surprising though, whenever I hear you talk about that, is that actually the dental industry is a very big industry when it comes to revenue. And when you think about that, the tools that we have to work with, right? And that's something that John and I always talk about is, what about the potential that you can do in your practice? And we're not just talking about making more money. We're talking about the potential of being able to get your time back.
That's right.
Being able to make your team like rock stars, all those different things. So I want to segue into our next topic here. Piggybacking on that is, the one thing I always hear about when people talk about Archie when they do a demo, they're like, this is really easy. In fact, guys, John never really did a true demo with me. He kind of just showed me some stuff. He was like, Glenn, here's an account and just mess around with it. I literally went in there and I kid you not, in less than 30 minutes, I felt like I knew the whole thing. Now, I am a dentist and I work with practice management, so I'll give myself a little bit of credit. But if I can figure it out in 30 minutes, pretty much almost every dentist can. And again, is that by design?
It is by design, and I will tell you actually some of it came from even my own experience working in a dental practice with my wife. Sometime I was helping her at the front desk, and I remember it was mostly on Saturdays, trying to help her. I was off for my work. And I had post-its in front of me, new patient exam, recall, SRPs, and I had to learn, and I had post-its with
like post-its everywhere.
That's right. And I was like, we need to make this easier. So if you have to hire someone who doesn't know dentistry, they should be able to use the product very quickly, which is, I'm sure you know it, one of the number one challenge right now in dentistry is really hiring, staffing, retaining your employees. So now if you can, the advice I would often give to dentists is to hire for attitude. Hire someone with the right attitude that would want to learn. We have the product that will help them, compared to hiring someone who has 20, 30 years of experience, which will be very hard to find. That's the issue in the market right now.
Well, that, and also, do you have the resources to hire them? Let's be honest here. It's John experienced, for those who out there who are doing a startup or actually are in a startup right now, this man right here lived through it all. And when I say lived through it all, I meant like at dinner time, he would hear all the complaints, all the things, all the struggles. I mean, even now, he hears it all the time for all of us now, all his clients right there, right? So again, I mean, when you built Archie, you literally had that in mind. These newer offices that are having the same issues.
That's right. I mean, the goal was, can you sign up with Archy if you're a new dental startup? Be ready to go. Hire someone. I mean, I always use the example of a barista at Starbucks. My first, actually, in my wife's practice, our first front office came from Home Depot. Didn't know dentistry. And so we wanted to make sure that she could get started, book appointment, add patients, schedule like specific type of appointment very easily, verify insurance, which is often quite complicated.
Yeah.
A present treatment plan, that's even more complicated. File claims, process EOBs, all of those tasks, very tedious, very manual, very complicated. Right now on Archie, we made it much easier. Another part is billing. I always say billing in dentistry is challenging because of dental insurances, primary claim, secondary claim, denial, and we made it that we spent almost a year building the ledger on Archie. And that's a feedback we get quite often, is that you have to be able to answer two questions from your patient. How much money do I owe? Why do I owe money? Right? I'm sure you have heard that
all the time.
And so we made this much easier to even answer those two questions.
Wow. So, John, I mean, again, like Andrew, who's with your team, I've worked with him and he was talking about like, well, Archie is like the wave of the future, right? Everybody else is like back in the old days, look, I mean, I'm going to pull something out here and I'm proud to hold it up. But this is my Google Pixel phone right here, okay? My Google Pixel phone, right? I'm super proud Android user. My wife rolls her eyes. Inside, John is rolling his eyes inside right there. But what's so cool about this phone right here is because, well, our smartphones, it's a camera, it's an MP3 player. I mean, it's a little computer. It's so many different things. But back in the day, again, Andrew, who's with the Archie team, he has this persona, like this 80s persona where he's carrying a boombox, carrying a camera, carrying all these different things. But yet right now in the dental practice, I mean, we're laughing about that. Like, I would never carry a bunch of different devices. I would just only have like my one phone. But right now in the dental practice, you're literally doing that. You got a PMS. You got reminder service, imaging,
patient engagement for appointment reminders, reporting, billing, RCM, revenue cycle management.
I mean, gosh,
employee management, payroll. I can list. Yeah,
I mean, and that's just off the top of our head. But again, like with Archie, everything's all put into one place.
That's right.
And again, why is that so important? Other than the fact that, I mean, for me, it saves money. I'm very passionate about that. But also, when everything is all working together in the same environment, you coming from the tech world, why is that superior to multiple bolt-ons?
I mean, that was actually one of the issues I identified really early with my wife. She had to use so many different software to run the business. And
you have to learn a bunch of stuff too.
You have to learn, you have to train your staff. Sometimes those software integrate well, but suddenly it breaks. And then who do you contact?
Yeah.
You have two companies that will shoot at each other. It's not my fault, it's their fault. And so
it's like the Spider-Man meme where they're pointing to each other. They're blaming each other.
That's right. And so the idea was like, can we have everything into one platform? Just to give an example, we have our own imaging platform right now where you can take x-rays. We actually even brought Pearl AI actually on top of it. So now imagine if you are using different platforms, you could be using the practice management software, your imaging software, and then your AI. So that's 3 different platforms to view an x-ray.
Wow.
With Archie, it's all in one. There is no integration. That's actually one of the values. Same with billing. Again, we wanted to make it, right now you can charge a patient. We have point of sales that we provide. The point of sales will beep, patient can pay. The transaction will go through, we update the ledger. There is no more need to type on a credit card machine and re-enter that amount with the mistake that can come with it,
And I love the fact that you bring that up. And again, I'm just, I'm not sure if I can just, let spill the beans here, let the cat out of the bag. But I mean, Archie is really big on making sure that when you open the best type of platforms, the best type of products is you open the box, it's ready to go, right? You get your phone out, you can start using your phone right away. You don't have to download a bunch of stuff, whatever. But I mean, they're not just stopping with some of these other apps and platforms. I mean, we're talking about some hardware stuff that you're working on to where it's integrated. So there's no, hey, let me get the customer service to download something for me. I mean, you truly are, moving towards, you open the box, you use it right away like your phone. So again, I kind of just tease it a little bit, but talk about some of the hardware stuff that we use all the time that you are working with, not just like a distributor. You're actually working with manufacturers to do integration with.
I mean, we can tease a little, but
tease a little bit here.
There is one device that every practice has to use on a daily basis, multiple times a day, which is your sensor.
Yes.
And so there is something coming up there that we'll announce fairly shortly to help actually not just the practice management, not just software, but the hardware that comes with it.
Yeah.
Directly integrated, providing a better experience, faster experience as well during an appointment. And so we're quite excited about what is coming there.
And it makes the team, and it makes the life for the team and the practice owner. So, I mean, again, all I have to tell you guys is whenever you get new equipment, think about how hard it is. You got to install it on every computer. You gotta install updates. You gotta learn how to use it. You can't just plug it in. What John's talking about here is literally, you get device, you plug in, you use device.
That's right.
Just like the phone. I'm excited about that. Okay, so before we wrap up here, I mean, again, we can talk all day. I do want to bring out one thing. Not only John's CEO of Archy, but he also, just to let you guys know, he did endorse my book. So it's right there. Check it out. John, thank you so much for the endorsement right there. It's here in the book here.
Congratulations.
Yeah, no, thank you so much. So, look, man, you're legit, man, when one of the CEO of companies endorses your book, right? But, for those who are wanting to learn more about Archy, again, you guys out there might think like, oh, these guys are fairly new. Look, I'm telling you something. There's a reason why Archy keeps on popping up in your feed. There's a reason why your friends are doing demos. There's a reason why people are talking about it, because this is different. And again, for those people who want to experience that, John, what's the best way? Other than you can always DM me, and I will message this guy and have him talk to you, right? But other than that, what's the best way for them to
there are multiple ways. First, you can go to archy.com, our website. You can book a demo online. Of course, if you're a Nifty Thrifty member, you can also sometimes post on Nifty Thrifty. You will see some of our customers will most likely comment about their experience. But feel free to reach out to Glenn, to myself directly, or our sales at archy.com. We'll follow up and book a demo with you.
And of course, there's a nifty deal, right?
Of course there is.
Of course there is. And guys, I mean, and if you're looking at his shirt right here, which is sweet. Actually, you know what? Can I grab is there a dentist shirt? Okay. I mean, I'm just going to put some pressure on John here. Put a lot of pressure on him. But these really cool shirts, they actually give these out at the trade show. So if you're ever at a trade show and Archy is there, you need to make a beeline to the booth, get hooked up. Well, hear about Archy and get hooked up with one of these shirts. But look, I mean, if someone signs up, you'll ship up a shirt, right?
Of course.
There you go. I mean, super comfortable too. So I got that. But John, thank you so much for jumping on.
Thank you, Glenn.
Appreciate it, guys. Reach out to them. Thanks for tuning in. We'll see you guys next time.
Take care, everyone.